Hi everybody, my name is Steph. I am a GP trainee, currently based in London, and I have depression and anxiety. And the reason I speak out about that is because I'm very passionate about ending the stigma around mental health. So it's really interesting when I think about my mental health and where I'm at now and at what point things really started. I only got help 2 years ago at the age of 27. And at that point, I had to get help because I wasn't functioning very well at work. I was crying every day. I couldn't really do my job. But when I reflect back, I actually think I had a panic attack even in primary school, and at secondary school definitely had a year when I just have this vague memory of crying all the time, and I'm not really sure why. My parents were always very encouraging to try and get me to get support and try and empower me to want to help myself, but I was very, very worried about being judged. I've also been in a place when I've been incredibly depressed and not able to get out of bed, and that low motivation and the feeling of nothing will ever get better. Nothing will ever get better. I will never get rid of this pain. When things have been really dark, so I'm someone who, I think it's about 1 in 5 people that's estimated to have will experience suicidal thoughts in their life. And that's something that I've had. And you just feel like there's no way forward. Everyone feels differently, but I felt like there was no way forward. I felt that the pain that I was going through was so unbearable that I didn't want to exist anymore. And that's a horrible place to be. I mean, with that came a lot of anxiety. So I was feeling stressed every day. I was crying at work every day. And I had a really supportive supervisor at that time. My supervisor had said to me, I'm a bit worried about you. Are you okay? And I was like, yes. I'm going to keep going. It wasn't until a day where my colleague, one of the pharmacists, asked me to write up a drug chart or something like that, something that I would have been able to do normally without an issue. And I couldn't compute the question. And I remember being sat there, and because there was so many thoughts and stress and being overwhelmed going around in my head, I couldn't understand the question that was being asked of me. And I just thought, this isn't safe. This isn't safe for me looking after my patients. And that's what it was that triggered me to go and seek some help. And my first thought at that point was, it's weird to think about this now because I have such a different opinion on it, but I was so ashamed. I was so disappointed in myself. I thought I was a letdown. I thought I was weak. I went to see my GP just in tears, and they said, I'd like you to take some time off. I think you're not coping at the moment, and I think you need just to reset. And they also recommended me to an organization called Practitioner Health Program, which I've benefited from a lot. So that is, they provide therapy and support for doctors and dentists in the UK. And I've been really, really lucky to have therapy and support through that. And it took a while for me to realize that I wasn't a disappointment, and it's nothing to be ashamed of, and I'm not weak, and actually it's stronger to be able to recognize these things and want to help yourself. But it took me a really long while, and it wasn't easy that first time. So in terms of keeping myself well at the moment, I want to mention 2 things because they're things that I previously had this internalized stigma about, and that is that I take an antidepressant tablet, and that I have therapy sessions, and they're on the phone at the moment because of COVID, unfortunately. But I've benefited a lot from having therapy and learning so much from it. And I think that I previously felt incredibly ashamed, and that people would judge me if I got access therapy, and this feeling that it's something abnormal and something not right with you. Whereas now I'm fortunately in a much more positive mindset, and I would prescribe it to everyone if I could, and I would love it to be more accessible. I'm very hopeful that it will be more accessible in the future for people. And the medication I just mentioned, because I think it has been helpful for me. It's not that a pill can fix everything, and it's not that a pill is for everyone. But the reason I'd resisted taking medication for so long, and I didn't take it until last year, was because of the stigma. And I thought, I can handle this by myself. I don't need a pill. I don't want to be associated with antidepressants. That's not for me. And I have found that through accepting taking the medication, trying it and saying, okay, let's see if this does help, it actually made me realize that I care more about my own mental health and looking after myself than I do about other people's opinions, which I think is so nice. What I learned is that there is light at the end of the tunnel and things can get better, and generally things will get better. And I would hate to think that people who are in a similar situation were ashamed and were worried about being judged and were worried about what work would say or worried about all these things. And this barrier of all this stigma was meaning that they didn't get the help that I've been lucky enough to get. And so I thought, oh, let's just talk about it more.